surgeon reveals. This exercise improves poor leg circulation after 60. For over 4 decades, an esteemed surgeon and dedicated medical researcher has been meticulously investigating a critical question. Why do individuals over the age of 60 often experience a significant decline in mobility, strength, and overall stability? Through years of rigorous study and clinical observation, a profoundly alarming truth has come to light. Compromised circulation in the legs stands as one of the most insidious, severely underestimated, and dangerously silent culprits behind physical deterioration in older adulthood. What truly makes this discovery so concerning is the insidious nature of the problem. The vast majority of people remain entirely unaware of its presence until the damage has progressed to an advanced and often debilitating stage. Early, subtle indicators, such as a persistent feeling of heaviness in the legs, a constant chill in the feet, unexplained tingling sensations, recurrent muscle cramps, noticeable swelling, and a gradual, unsettling loss of balance only begin to manifest after poor circulation has been silently eroding the body's systems for many years. It is precisely at this juncture, when these seemingly minor discomforts become persistent issues, that the narrative surrounding age-related decline undergoes a profound shift. While conventional wisdom widely champions walking as a healthy and beneficial activity, it is crucial to understand that typical, everyday ambulation often falls short in its ability to adequately activate the deep-seated blood vessels that are fundamentally responsible for nourishing the muscles and tissues throughout the lower extremities. In essence, simply walking by itself is frequently insufficient to counteract the progressive circulatory decline. However, there is a beacon of hope amidst this alarming revelation. The good news is that science has identified specific, clinically validated exercises meticulously designed to reactivate this crucial deep circulation, awaken those previously inactive vessels, and remarkably restore strength, stability, and vital independence to individuals within a mere matter of weeks. This profound potential is precisely why this comprehensive video aims to unveil 5 surgeon-approved exercises specifically engineered to dramatically improve leg circulation for those over 60, with particular emphasis on exercise number 2, which possesses such extraordinary power that it can effectively reopen even the most deeply entrenched vessels, those vital conduits essential for muscle regeneration and the robust recovery of strength. The repercussions of inadequate circulation extend far beyond the superficial annoyance of simple discomfort or the occasional bout of fatigue. As the efficient flow of blood begins its insidious decline, the entire body imperceptibly embarks upon a silent yet relentlessly progressive journey of deterioration. The intricate network of arteries, fundamental to our circulatory health, gradually loses its inherent capacity to properly dilate and contract, a critical physiological phenomenon known as endothelial dysfunction. This impairment directly translates into a reduced and inefficient delivery of life-sustaining oxygen and essential nutrients to the body's myriad tissues. Simultaneously, the crucial perfusion pressure, which drives blood into the smaller vessels, diminishes, leading to the collapse of the smallest capillaries, the delicate microscopic pathways solely responsible for directly nourishing individual muscle fibers and sensitive nerves. This explains why the initial indicators of poor circulation are rarely characterized by intense, acute pain. Instead, they manifest as seemingly innocuous signals: a dull numbness, a recurring tingling sensation, an inexplicable coldness in the extremities, a generalized weakness, or an uncharacteristic clumsiness when performing the act of walking. Over an extended period, this chronic lack of proper blood irrigation inevitably culminates in observable muscle atrophy, a disheartening loss of vital reflexes, a significant decrease in proprioception, the body's innate and indispensable ability to accurately perceive the position and movement of its own limbs in space, and a marked reduction in the speed of neuromuscular response. These cumulative effects collectively elucidate why many older adults find themselves increasingly prone to losing their balance, tripping with alarming frequency, and gradually developing an unconscious, debilitating fear of movement. This pervasive apprehension, in turn, tragically accelerates the rate of physical deterioration, trapping individuals within a debilitating and cruel, vicious cycle of immobility, increasing dependence on others, and a profound, devastating loss of personal autonomy. Yet, it is vital to emphasize that this seemingly inexorable process is unequivocally not irreversible. Extensive research conducted across various disciplines, including vascular physiology, rehabilitation science, and cutting-edge aging medicine, has unequivocally demonstrated that specifically designed exercises tailored to intentionally force blood flow into the deep, often neglected layers of the muscles possess the remarkable capacity to reactivate circulation, even in individuals well over 60 years of age. These targeted movements diverge significantly from generalized physical activities like casual walking. Instead, they ingeniously generate precise changes in intramuscular pressure, powerfully activate the critical venous pump mechanism within the muscles, and stimulate the endogenous production of nitric oxide, a pivotal signaling molecule that plays an indispensable role in allowing blood vessels to effectively dilate and regain their crucial flexibility. Advanced investigative techniques, such as Doppler ultrasound and functional magnetic resonance imaging, have definitively shown that this specialized type of physiological stimulus can dramatically augment blood flow within mere minutes, tangibly reduce peripheral swelling in just a few days, and markedly enhance postural stability within a span of weeks. Furthermore, once blood flow is reestablished and begins to circulate optimally again, an additional, profoundly beneficial process called angiogenesis is activated. This involves the natural creation of entirely new capillaries, which work to permanently improve the oxygenation of tissues. This cascade of positive physiological changes translates directly not only into demonstrably stronger legs, but also into significantly greater endurance, vastly improved coordination, and a remarkable, deeply felt recovery of confidence and assuredness when walking. In essence, the objective transcends merely moving the legs. It is about strategically reprogramming the entire circulatory system to efficiently function once more, mirroring the robust efficacy it exhibited in one's younger years. Among these transformative interventions, the fifth exercise, heel raises with progressive hold technique, stands out as deceptively simple yet extraordinarily potent for reigniting circulation within the legs. Its power stems from directly stimulating what is frequently referred to as the body's second heart, the calf muscles, particularly the gastrocnemius and soleus. In the intricate realm of vascular physiology, these specific muscles operate as a true peripheral pump. With each deliberate contraction, they meticulously compress the deep veins nestled within the lower leg, vigorously propelling oxygen-depleted blood back toward the heart, effectively defying the relentless pull of gravity. As we age, this vital muscular pump invariably experiences a decline in efficiency, a consequence of age-related loss of muscle mass, sarcopenia, a reduction in precise neuromuscular activation, and an unfortunate stiffening of the blood vessels themselves. This explains why, in the absence of adequately activated calves, blood tends to pool in the lower extremities, manifesting as persistent swelling, an oppressive feeling of heaviness, and a pervasive, often distressing coldness in the feet and ankles. Heel raises, when executed correctly, serve to reactivate this natural intrinsic pumping mechanism, providing an immediate and significant improvement in venous return. This immediate physiological response is precisely why many individuals report experiencing a reassuring warmth, a gentle tingling sensation, or a profound sense of relief within just a few minutes of performing the exercise. It signifies oxygen-rich, blood-reaching areas that have been chronically undersupplied for an extended period. What truly elevates this exercise into an advanced therapeutic tool is the ingenious application of the progressive hold technique. by consciously sustaining the contraction at the peak of the movement for several measured seconds, a controlled and strategic increase in intramuscular pressure is generated. This sustained pressure acts as a powerful stimulus to the vascular endothelium, the inner lining of blood vessels, thereby promoting the critical release of nitric oxide. This remarkable substance is absolutely central to circulatory health because it dramatically enhances the elasticity of the arteries, allowing blood to flow with far greater ease and efficiency. Moreover, comprehensive studies in exercise physiology have irrefutably demonstrated that this type of sustained tension actively triggers a phenomenon known as metabolic stress, which is one of the primary and most potent drivers of angiogenesis, the crucial formation of entirely new capillaries. For older adults, this translates into the invaluable creation of new, viable routes for blood to navigate and reach muscles and nerves, fundamentally improving oxygenation in a lasting and profound manner. Clinical research has documented impressive increases of up to 40% in venous return when this seemingly simple exercise is performed both correctly and consistently. Unlike many other physical movements, heel raises demand no impact on joints, no specialized equipment, and no expansive spaces, rendering them an ideal and supremely accessible option for individuals grappling with pre-existing joint problems or compromised balance. Through regular and dedicated practice, this exercise not only cultivates superior circulation, but also markedly enhances water